So right now, during this crisis, intensive care beds in London, in the West Midlands and in other regions are hugely in demand. And we wouldn't normally use one of those resources for someone about whom we weren't pretty concerned. And I would suggest that that remains the case, even if you're the Prime Minister. This decision wouldn't have been taken lightly, I suspect.
What would cause concern?
So most of what we're seeing in terms of referrals to intensive care is about people who have very low levels of oxygen in their blood. People seem with this condition to be able to cope with low levels of oxygen better than they would with, for example, a normal bacterial pneumonia. But when those levels dip to a dangerous level that might threaten other organs in the body, then we bring them to intensive care.
So you give them oxygen to start with on the ward, do you, and then see how they get on?
Absolutely. And in normal times outside this crisis, the ward can give oxygen. Now, most hospitals, the wards are giving enhanced forms of breathing support, including a device called CPAP, which applies a tight-fitting face mask and some positive pressure to help to open the lungs up a bit. So for him to require intensive care would suggest, and again, this is purely speculation, that one or both of those therapies hadn't returned his blood oxygen levels to normal.
Okay, so generally the CPAP, the extra tight mask, I suppose, is what we'll say in layman's terms. Generally, that would be given before you get to intensive care. We're not saying that's what happened in this case, but in your experience, with your expertise, that's generally what would happen.
In most hospitals right now, that is indeed the case. And we hear that the Prime Minister has not required mechanical ventilation yet, so he's not been sedated, he's not had a breathing tube placed down his throat, but that must be the concern of the doctors looking after him.